Good morning, everyone, and welcome to our Ask the Reporter live chat. I am Stephanie Chavez. I am the Times education editor, supervising our coverage of education issues in California and Los Angeles. I'm here today with two of my esteemed colleagues and reporters to take your questions during this time. First of all, I just quickly wanted to acknowledge, because we've been reporting on all these stories this year, just the difficulties and the challenges that all parents have experienced this year with your school-age children, really since March 2020 when schools shut down. And, here we are again at a time that was supposed to be a celebratory lead up to what we thought was going to be a near normal back to school. Instead, we find ourselves upended by the Delta variant surge and what that means for our kids and what that means for our school. I know, and we know in our newsroom, that this has prompted a number and a new round of worries among parents, among teachers, among students. And that is why we are here today with our in-house experts to address many of the questions that we have heard in the last couple weeks and that you are asking in the lead up to schools opening. Some schools have already begun to open, others will be opening next week and further on. So without further ado, I would like to introduce our two guests today, our two in-house experts. Howard Blume is the LA Times K-12 reporter. He has been chronicling education and its impact and the pandemic's impact on it really since March, and Howard just brings years of experience to this coverage in near daily reporting. Thank you, Howard, for all you've done. And Amina Kahn is a science reporter for the LA Times who has been reporting also on the impact of the pandemic on children, on others, and talks to a number of experts throughout the country in California daily. So we believe and hope that these two reporters, with their breadth of experience, can address some of the questions. Let's get to it, and let's start with Amina. Amina, the pressing question is that we know that the Delta variant is here, and we want to know, I think parents want to know, is it worse for children than previous strains? And what can you tell us about how children are being affected?
Sure. So the Delta variant, as we've all come to know, is much more contagious than other strains that we become familiar with. And as cases have gone up, there's probably a range of reasons for that. I mean, first off, kids who are 12 and under can't be vaccinated, right? So far, this is just going up relative to the adults. But the other thing is, kids are as safe as the people, and namely the adults around them, right? So the more the more coronavirus there is circulating in the community, the more likely it is that kids will be exposed. So a lot of the issue right now is just that Delta is more contagious. That's one of the ideas. It's unclear whether that the rise in hospitalizations of children that we're seeing, more kids, and that means it's also impacting the smaller share of kids who might end up with a serious COVID going around because coronavirus going around because Delta is so contagious. The other possibility is that COVID is Delta causes more severe disease, but it's really unclear right now. Scientists are still trying to figure out whether that's the case. For now, the fact that it is more contagious is the thing that we should all be worried about, whether we're adults or children, and that's all the more reason to be careful and mask up. But it's so far not clear that it's actually causing more severe disease in children. So that remains to be seen.
Thank you, Amina. I think, Howard, that kind of segues into the next and since we know that the Delta variant is contagious, we have been talking for months about safety protocol in schools, and now is the time when it's all going to come into play. I was wondering if you could just, Howard, outline what are kind of the key protocols that must be in place in school that parents should be looking for to ensure that their school is as safe as it can be.
Well, of course, I should first, I hate to sound like Barbara Ferrer, the county public health director, but we were told again and again that the most important thing that people can do is get vaccinated if they're eligible for vaccines. So I think that's worth noting if we're talking about safety protocols. But beyond that, if you're looking at what is going on in your school, and you have to be vigilant here because there's so much at stake. You want to make sure, unless you're opposed to masking, that everybody is actually masking. And the rule is that you have to mask indoors. And some districts, including LA Unified, say you have to mask outdoors as well. And that is the single most important thing, that people are using masks correctly. They are using them pervasively. Also, that there's a health screening, that sick kids are not coming to school. The message is clear that sick kids should be staying home, and there's some effort to track that. Things that will not be happening as much would be social distancing. That has been dropped because the state has decided to prioritize getting all the students back to school, and they can't do that with the physical distancing requirements that we had earlier. So they dropped that, but mask mandates are the big one. Ventilation is kind of hard for a parent to check on, but it's also considered very important. And then there's things they can ask their kids about. Are all the supplies separate? Does each kid have their own supplies? Are kids being asked to wash their hands all the time? Are kids being kept apart as much as possible? Are the meals being taken care of outside as opposed to inside? Because things that you have to do, removing the mask, should be done outside as much as possible. So those are things that parents can kind of look out for and ask their kids about.
So Howard, just to confirm, so distancing is urged to the extent possible, but is not required, that the first priority is to bring all students back full time, correct?
Right, and that's somewhat controversial. A lot of people would like there to still be physical distancing, and Amina, of course, is the expert on this, but I have seen a lot of reports that say, we had the reports that 3 feet is just as good as 6 feet. Then there was studies that said, well, it's really just the air circulating around the room. So physical distancing has been dropped as a central requirement, but masking seems to be more important than ever. Ventilation is important. Better ventilation can be achieved by opening a window in the classroom. And in many classrooms, they will be running both the heating or air conditioning and having a window open at the same time, which would have been horrible practice in years past to conserve energy. But now that's actually a good idea to make things safer, because those air conditioning and heating systems actually should have a high grade filter called a MERV 13, and that should be improving the quality of the air, and opening a window would also improve the quality of the air. And then just keeping people as far apart as possible. I mean, that seems uh, vague to the point that it must make parents a little mad. Well, how far apart is as much as possible? And the answer is, well, as much as possible. And that's pretty much what we get on physical distancing.
All right. Amina, anything to add from the scientists, doctors, experts you're in touch with?
Only to echo some of what Howard said already, which is that ventilation is key, masking is key. There's a growing amount of evidence that shows that surface transmission is not nearly as important. In fact, it's probably negligible compared to aerosol. Being near someone who is contagious, is talking, is breathing out, and you breathe in some of those particles. So all the mitigation strategies to minimize that, which is wearing the correct kind of masks, having very good ventilation, having windows open, those are the things that really need to be prioritized. I think there is controversy over the physical distancing. But the risk.
Thank you. Hey, Howard, moving to the issue of masking in California, you've written extensively about the mask mandate. Can you just give us a few details, and also important, how the heck is this being enforced?
Well, that's very interesting. The state initially said it was going to enforce a mask mandate, or that districts had to enforce it. Then there was some political flack for that, and the state backed down and said, hey, the rule is that you all have to wear masks, but we're not going to enforce it ourselves. We're not going to check to whether you're enforcing it or not. And immediately there were some schools and districts that said, well, we don't really believe in a mask mandate, and we're going to have it in our rules because the state says we have to, but we're not going to enforce it. And then there are places that are really going to enforce it. Certainly LA Unified is going to enforce it. And if you come to the school and you do not want to wear a mask, unless you have a health exemption, then you are going to have to wear a mask, or you are going to have to do school online. And they will give you counseling. They will try to persuade you, but you will have to do school online if you don't wear a mask. There are other states, notably Florida, Texas, Arkansas, where the governors have said, well, we're going to say that you cannot put a mask mandate on schools. And there are some districts in those states that said, we're going to put a mask mandate anyway, because we feel that we have to do what we think is going to protect the health of everybody. But in California, it is the law. Only it's up to local districts and schools to enforce. But as Amina said, hey, the experts are saying it's actually what you should be doing for health reasons as well.
Howard, in some of our reporting, we have talked to different schools and principals and even students about what they think of all this. Can you just give us a few thoughts about what you've heard from superintendents and principals about how they are going to enforce it? Because we know school rules are nothing new.
Right. Well, most of the students that we've talked to have said, they don't particularly like wearing masks either, but they're kind of used to it by now, and they're going to do it. And the trade-off is worth it because they get to be with their friends. They get to learn directly from their teachers. There's certainly a very strong contingent of parents who are saying that the masks give their kids headaches. They have trouble breathing through masks. And there are a small number of kids with certain disabilities who absolutely cannot wear a mask. And there are alternatives in those cases. There are, for example, face shields with a drape around them. And there may be some kids who can't wear those either. And in those cases, parents can apply for an exemption. But you can't get an exemption from the mask mandate simply because you say it makes you feel uncomfortable, or it's harder to breathe than normal, or you can't play basketball as easily, or things like that. That's pretty much the landscape on that.
All right. Amina, can you tell us anything about what might be the best kind of mask for a child, or, a person in any case?
For certainly. The best mask for adults, and I think it's the same for children, the amount of particles that escape. So having that double layer is really, really important, and a good seal is really, really important. There are other options to make things more comfortable for Redbird. I think there's like these little sort of rubber, I guess, I don't know what they are, but they're kind of molds that can sort of like make it pop out a little bit so that you feel like you have more space to breathe. There's all kinds of options out there. But the bottom line is you have to have a double layered mask. And that, it's not like you need an N95. I'm sure that's great, but the double layer will do the trick for most of that risk mitigation.
But schools are not enforcing the double layer. It's important to note. It's basically, they just want to see you wear something. Also, schools are required to provide a mask if you don't come. Even if you get on the bus and you don't have a mask, the bus driver, the state law literally says that a bus driver has to have a mask to give to students if students don't. And by the way, I tried one of those molds, and they actually do help you breathe more easily, creating that little extra space. So I'm glad Amina mentioned that.
All right. Thank you. Hey, let's move on to the other. There's so many pressing issues, but now let's move on to vaccines. Howard, big news yesterday on the issue of vaccines at schools. Why don't you fill us in on what the latest is on that in California?
Right. In California, And California is certainly taking a more aggressive stand than virtually any other state. And what the governor said, Governor Newsom said that all school district employees will either have to be vaccinated and provide documentation of that, or they have to submit to weekly coronavirus testing to screen for the virus. And that's the rule. It does not apply to students. It is only for school employees, but it is all in school employees, and it's also volunteers. So if you are a parent and you want to spend time on campus or volunteer, and a lot of parents do this, then you too have to either be vaccinated and provide documentation, or you have to submit to weekly coronavirus testing.
Question, Amina, and I don't know if you can answer, but I mean, what about coronavirus testing? A weekly or a twice weekly test. How really effective is that going to be to stopping the spread of infection?
I think it's important to do the testing. It's not necessarily going to catch all of the cases, especially since Delta seems to operate on a shorter timeline than earlier variants, right? So you become contagious with Delta like a few days earlier than you would have with some of the other variants. That said, it will certainly catch a bunch of cases, and that'll allow people to do some contact tracing to send those kids home to make sure no one else gets infected. So I can't say exactly how effective they're going to be. I don't know if it'll catch 100% of cases, but it's essential.
Let me just continue with you on the issue of vaccines. Can you, with the Delta surge right now, can you help us understand what the risk may be for unvaccinated children? We know that those are children 12 and under.
I'm sorry, could you repeat the question?
Could you explain what could be the risk for unvaccinated children 12 and under?
Oh, yes. Yes. So generally, I mean, children are vulnerable right now because they're not vaccinated, children 12 and under. So that's a problem. That said, so far, it seems like most of the cases in younger children seem to be of the milder variety. That's good. The problem is Delta is much more contagious. And so that means that if, your kid happens to be one of the children who might turn out to be more prone to having a serious case of COVID, there's a higher likelihood that they'll get coronavirus and then have that more serious case just because there's more virus going around. At least that's the thinking. So the risk there is just that there's a higher likelihood that you'll encounter the virus. That's a problem. And otherwise, it's unclear whether the Delta variant is any more contagious. More virulent. It's unclear whether it causes more severe disease. But because they don't have any of that protection, unless they've already had COVID and have antibody protection, which is not necessarily as good as vaccine protection, by the way, but at least offers something, they are going to be vulnerable. And that's why it's really, really important to make sure that all of these protocols, ventilation and especially masking the other day, but reading about all of these students who've really become accustomed to masks and following the protocols, they have no problem with doing it. And in fact, there was at least one student interviewed who was an athlete, and he said, actually, I think that being in a mask has improved my stamina. So frankly, it makes me a better athlete and gives me an edge. I kind of actually find it inspiring that they've been able to adapt and kind of thrive under these difficult circumstances far better than like a lot of us adults have. So I don't think there'll be an issue there as well. So I think so long as kids, stick with the protocols, people will try to keep as safe as they possibly can.
Just in talking,
especially without
in talking about that story that you mentioned, that was done by our education reporter, Melissa Gomez, and we wanted to find out how kids were adopting to masks. And she literally spent 2 weeks going from school to school in the heat of summer to summer school to see what students were saying. And, we weren't sure what we were going to find. And quite frankly, it was quite surprising. As we said, it was like a big meh, they were dealing with it. And yes, it was very inspiring to hear that. And that story you know, I think was an important, those students and what they were saying, again, in Los Angeles, in the middle of summer, in summer school, wearing masks, was an important voice for us to hear, and I'm really glad we did that. So thank you, Amina and Howard, on that. You know, Howard, I don't know if if you've heard any talk yet about mandating vaccines in schools. Number one, mandating them for teachers and staff. Perhaps later, mandating them for students once there is full FDA approval of the vaccine. Have you heard anything, or is it just too early now to even start thinking about this?
No, it's not too early. In fact, it's a very live issue when it comes to mandating them for teachers and others who work at a school. I mean, if you think about it, most teachers have been willing to get vaccinated and have been vaccinated. So if you're a teacher who has been vaccinated, you're in the majority, and yet you are more susceptible to the Delta variant, to a breakthrough infection, if your colleagues have not been vaccinated yet. So there seem to be a clear majority of teachers who would be very comfortable with a vaccine mandate, because that would give them additional protections and might nudge their hesitant colleagues along. And that may be what's pushing the leadership of the teachers union closer and closer, in some cases all the way over the edge, to saying, yeah, we'll go along with a vaccine mandate. Let's just make sure there are medical and religious exemptions for those people, that tiny percentage who really need them. And let's approach this with sensitivity. Let's try to persuade people. Let's do it in a way that's humane. But I think vaccine mandates for teachers are pretty much, I'd say the odds are that they're going to happen. Also, the vaccine, the Pfizer vaccine in particular, and Amina could speak to this probably more directly, but my understanding is that a full authorization by the Food and Drug Administration, which oversees this, that could be a couple of months away for that. And once that happens, then it's going to be a lot easier to mandate these vaccines, because so far they've been given on an emergency use authorization. I mean, it's still playing the odds, it seems, to get the vaccine, even when it's an emergency use, because the odds seem way better to get the vaccine than to not get it. But with the full FDA approval, that changes things. Now with children, the vaccine, with children younger than 12, I should say, the vaccines have not been authorized yet, and it will be first an emergency use authorization. And it seems unlikely that there will be a mandate for children until there's full FDA approval. Having said that, there are lots of vaccines that are mandated for kids, and California has tightened up the rules with other vaccination exceptions that families have had in the past. And this vaccine could follow the path of other vaccines and ultimately be required.
Thank you, Howard. Amina, a question has come in that I wanted to put to you to hopefully answer to the best of your ability, dealing with children under 12 who are not vaccinated, because they're not, the vaccine, of course, is not available to them. Are they more likely to contract the Delta variant, even if they are masked at school? Is there anything we know about that yet?
I think it's really difficult to say because of the fact that we just don't have a lot of data yet. I will say, I think, Howard, you did a very interesting story. Please correct me if it wasn't you, but on summer school and the summer school numbers out of LAUSD. And over the 5 weeks of summer school cases, and this sort of paralleled the rise of Delta cases actually among the student body did go up pretty significantly. However, I don't think there were any serious or hospitalized cases, which of course, serious cases of COVID if they are infected with the coronavirus. So I'm not sure what scientific data is available yet, but that, I mean, I guess I would call it anecdotal, or at least one sort of example. It's not been vetted by science or anything like that, but that example of, yes, the numbers will probably go up. I mean, assuming everybody at LA, involved in these cases was masking up appropriately, it does seem like there is probably a little bit of higher risk. But again, that's one example. We can't draw any hard conclusions. It's just interesting and might be telling about what's to come in the school year. So we'll just have to keep a lookout and keep an eye on the numbers and see what happens. In a lot of ways, we're all kind of living the experiment. And I know it's not something we like to hear, but these are the trade-offs we're making to make sure that kids get the education and the socialization and all the other benefits of school that they need. So that's the trade-off that public health authorities and education authorities are making, I think, and trying to weigh.
If I may jump in on that point, when you're talking about a school, there are two kinds of infections, right? There's the infections that walk in the door that have nothing to do with school. And we assume, and this was borne out in the past, that most of the infections that you'll find out through a school screening program have just walked in the door. They caught them at home, they caught them in the playground, they caught them after school. And what you're doing with the screening program is that you're finding these infections and you're limiting the chance that these infections will spread to other people through an outbreak. Now, what that's telling you is something of the prevalence of the virus in the community when you do that kind of screening and you find those kind of infections. And the risk that those kind of infections have, of course, is that not only does it tell you what's going on in the community, but those children have to quarantine. And if enough of them have that infection, you could have a classroom quarantine, et cetera, and you could have disruptions. Now, the more worrisome, I mean, that's bad enough, all right, in these times. But worse than that would be if you had an infection that spread at the school. That would be considered an outbreak. When one person comes into the school with an infection, and while at school, that infection spreads to other people, that is very likely to cause a disruption to education. At the school, you might have a classroom shut down, you might have a group of students. In the worst case scenario, you might have a school shut down. But what that would also tell you is that there may be a breakdown in the safety protocols at the school, or at the very least, some people, maybe a small group, weren't following the protocols. There were some documented instances at Unified where some adults caught the virus on the campus, the infection on the campus. And in those cases, it was because the adults weren't following the safety protocols. So is that a cause for alarm, or is that just saying, hey, the safety protocols work, but you got to follow them?
Howard.
Right. That did remind me, actually. I'm so sorry, Stephanie. I just wanted to add that I do remember in your story that you mentioned that there were very few cases that were actually traced to campus. So you're right. Most of these are actually reflecting the community transmission. So, I mean, so far it seems like they're doing a decent job if they're following protocols.
No,
sorry.
Yeah.
Just wanted to add that in before I forgot.
I just wanted to note, because having edited that story, Howard, one of the points that I remembered really clearly in the single digit number of outbreaks that were reported all during summer school, most of them were related to very sloppy practices in athletics, lack of mask wearing indoors, close contact, traveling, perhaps.
Right. Well, those are for outbreaks, right? So over 1 week.
So that was something to note too. It wasn't
right. So yes, number of outbreaks during the last week in July, there were 7 related to youth activities, and I don't know whether that's a lot or a little, but they were generally related to poor practice. And an outbreak, just to define what an outbreak is for those who may not know, it's 3 or more cases at a school or a program, a youth program, whether it be sports or an after-school program, it could be childcare, but 3 or more cases over a 14-day period that appear to be linked. That is the county definition of an outbreak. Now, if you have a single person-to-person transmission case, I mean, there were some of those during summer school. It wasn't single digits, but it was a relatively low number compared to total cases. But an outbreak is something beyond that. And there were outbreaks, but they were generally related to documented instances of people not doing what they were supposed to.
right. Since we're on this topic, I mean, there's a couple things I still want to cover. Let's kind of segue into this issue of outbreaks, because I know that is a pressing question among parents. What can we say right now about the protocols that will unfold at a school when a child or a teacher tests positive?
When a child or teacher tests positive, that person has to go home. So a teacher can stay home from work. That teacher can get in the car and drive home. student has to go to a separate area, and this is a student who may or may not be experiencing symptoms. They're kept in that area. The parent is called. The parent comes and get that student. Now, if they immediately have some close contacts who they know were exposed to that person in a way that meets the definition of a close contact, they also have a separate area called an isolation tent as opposed to a quarantine tent. I hope I'm getting my terms right, but basically it's a separate area. And oftentimes these are outdoors and they have a tented shade structure, so it's not too unpleasant. And we do benefit from good California weather that way. But those kids who may be exposed, but who are not obviously sick, they don't want to put them in the same tent as the person who is absolutely sick. So they have a separate holding area for those kids until they go home. Now, people who have been vaccinated have a faster path to get back. They can test negative and get back to school in a matter of days, virtually right away. Those who are not vaccinated or who test positive, they have a longer path back. It can be up to 10 days. You need a negative test. You need to recover from your symptoms. It can vary a little bit who falls under that. I mean, LA Unified has a definition of a close contact. I was just talking with their communications person shortly before we went on the air. And so she said, well, a close contact is someone who's been around a person, I believe it was 15 or more minutes within a 24-hour period, and that's within 6 feet. But as I'm sure Amina can explain, that can be cumulative. You know, if you're around one person who's infected for 4 minutes and a different person who's infected for 3 minutes, those numbers can add up to 15 minutes, at least according to some research I've seen, and that can count as a close contact. So figuring out who is a close contact can be complicated because it also matters, well, was the person vaccinated? Were people wearing masks? Were they close together indoors or outdoors? And in some cases, it seems that districts and school officials have left their responses a little bit on the vague side intentionally to give them flexibility in how to approach a situation. And I completely get that because every situation may be a little bit different, and the best response in one situation may not be the right response in another. But parents are driven a little mad by this seeming lack of consistency.
Can you tell us how the schools are encouraged or supposed to work with public health officials on positive tests in schools?
They are supposed to notify public health officials every time there's a positive test. So if anybody turns up as having the coronavirus, and by the way, the coronavirus is not the same as COVID-19. COVID-19 is when you have symptoms, but if you have no symptoms, then you still have a coronavirus infection at least, and the county gets notified. And if there are multiple cases and they appear to be linked, then the county opens an outbreak investigation, and presumably the county is consulting with the school as much as needed, giving them guidance on what to do. And this is to provide some consistency in practice as much as possible. I don't know what kind of resources the county has to do this, how much turnaround time, but if you think about it, this also involves identifying who the close contacts are, contacting them, and deciding what to do with all of them. By the way, you know, coronavirus testing itself, LA Unified has committed to testing everybody every week. That's 100,000 tests a day for Monday through Friday. So this is a big undertaking.
All right. I just wanted to ask you, Howard, what are parents entitled to know about a positive test in their child's classroom, in their child's school?
They're entitled to know, first of all, if their child has tested positive or negative for the coronavirus. And it seems they're entitled to know if their child is a close contact of somebody who tested positive or is suspected of having a coronavirus infection. They are not entitled to know who that close contact was. Now, I think some districts and schools will go further than this, and they will notify the entire class or the entire school. And certainly parents want this information. And again, parents in summer programs were driven crazy by hearing rumors of somebody testing positive, and some parents were notified and some weren't, and it wasn't clear how a close contact was defined. I'm sure the employees at the school who are trying to figure this out 99 times out of 100, we're probably trying to be conscientious and do the right thing and trying to figure out who is supposed to be notified and who wasn't. I'm not sure, for example, which of this information going to the county has to be put on a public dashboard. For example, if somebody walks in an infection that has nothing to do with the school, is the school going to report that, or is the school only going to report publicly those infections that were transmitted from one person to another at the school? Or is the school only going to go and report, only going to contact the close contacts and report the information only to the county? I'm sitting here after talking to people endlessly about this. I'm still not sure what the answer is right now.
All right, I think a lot of this will be evolving as school starts. Amina, is there anything you wanted to add to this conversation at all as we talk about positive tests, contact tracing, distancing?
Yeah, I think that I mean, I just can't reiterate enough that masking is important. And while it's not required, the right kind of mask is really important to keep kids safe. I know that we'll all be waiting for vaccine when those are going to be on their way. The DI has said things along the lines of later this year. From what I've read, I think Pfizer has said that they're going to try and submit their emergency use authorization for, I think, 5 to 12-year-olds around late September or somewhere in the fall timeline. But Moderna's may not come until early next year. So we've just got to hold out until vaccinations are available for more young school age kids. The other thing I will say is our vaccination rates among teens who are eligible for the vaccine are still pretty low. So one of the more important things that parents can do is probably to encourage their 12 to 17-year-olds to go out and get their shot and be part of the solution. I guess that's just me as a parent, I guess, saying, the more of us out there who have access to the vaccine who can get it, it's probably a good idea. So if you can get it, and that will mean that more kids in school will be safe, because there are some kids out there who are immunocompromised or can't get the vaccine for other reasons. There are kids out there who can't necessarily mask for other reasons. And so any way that we can protect those vulnerable children who still want to be in school and reap the benefits of school in person are important things for the community to do.
Thank you, Amina. I want to back just a little bit, because before we even get to a positive test, I know Howard, you just alluded to this, before we get to a positive test or a negative test, kids and teachers and staff need to be tested. Howard, can you tell us what the state has required, or what are the guidelines for testing in schools, and what we see happening along those lines right now?
A lot of this has to do with the governor's order from yesterday, and it was 1,000 different school districts, 1,000 different potential policies, but not anymore. Right now, for school employees, you either have to be vaccinated and show documentation of it, or you have to be tested every week, and that's that. How that testing is carried out is up to the school district. LA Unified, for example, is doing a pre-test. The period August 2 to August 14, that was when everybody was supposed to be tested and get initial results, positive or negative. Now, you could argue a test on August 2nd may not tell you much about somebody's infection status on August 16th, but at least it's something, and it establishes a baseline. And after that, mobile vans are supposed to go to schools every week. That's 100,000 tests a day overall. Parents do have to arrange to get that first baseline test, but after that, once school starts, it just happens on its own. The mobile van goes to the school and the test takes place. Other districts will do it differently. Children in LA Unified, of course, have to be tested as well. There's no testing requirement for students statewide. That is a local decision. There is money to pay for it, theoretically, and money previously provided by the state and federal governments. And that's pretty much how it works. Also, there are, and again, I'm going to rely on Amina to correct me because I'm almost sure to say something wrong here, but the state does not require what kind of test. So you have the PCR or molecular test, which are more expensive, more accurate, and take more turnaround time. In LA Unified, that's what they're relying on primarily. And they try to get results back overnight, ideally, but in 36 hours at the most. And we actually have had reports of a time lag that resulted in some quarantines that would have been unnecessary if there had been faster turnaround time. This was at I think at an early childhood center. At least it's an anecdotal report from a teacher and the mother of the teacher. Then there's the other kind of test, the antigen test, which has immediate turnaround. It's less expensive, but it's also less accurate. But if a kid in LA Unified shows up at the door on the opening of school and they haven't been tested yet, I think the plan is to give them an antigen test and try to get them in. And even though that's less accurate and they may have to do a follow-up test immediately or as soon as possible, they really don't want to turn kids away if they don't have to. But of course, they will turn kids away if that family refuses to do any test of any sort. I mean, is that enough of the answer to that question, Stephanie?
Thank you. And thank you, Howard. And I had a follow-up question for Amina too. I've heard some concerns among parents that, especially the nasal swab test is invasive, could be difficult for children. I'm just wondering from your breadth of work, if there are any concerns for testing with children, with coronavirus testing for children, or should we not worry about it?
In terms of like whether the swabs can hurt them, or
swabs can hurt them. Is it okay to get a test every week, twice a week, frequency?
Yeah, I haven't heard any objections to frequency of testing other than, I mean, it's uncomfortable. It's not always fun. Early in the pandemic, my like 9-month-old daughter had to get a test, and I can tell you she did not love it. But there were no ill effects as far as I know, other aside from some very aggressive sneezing and some complaining after that. So as far as I've heard, I don't think there's any big issues with that. I will add to what Howard said about the antigen testing. All of that sounded fine. The good thing, and he mentioned that, like, the kids will be potentially, if they're coming right into school, they'll be tested with an antigen test. The useful thing there is an antigen test, while it is less sensitive than a PCR test, it's kind of testing the viral load that you've got. So if you are infectious, the antigen test will pick it up because you have a lot of virus in your system. And that's the thing we really, really want to avoid, right? You want to avoid having people who are actually infectious, whereas a PCR test might pick it up a little bit earlier before you're like spewing virus everywhere. And that's useful to know because you can, get people out. So it makes sense to get people out of the system. And so antigen test definitely has its uses. And yeah, so they each serve slightly different purposes, different contexts. So they can both be useful. So don't worry if, you're getting an antigen test and you were like, oh, I want a PCR. There may be good reasons to get the antigen test and forgetting it.
All right, anyway. Thank you. Howard, I want to move on to a subject that I was hoping we wouldn't have to bring up for the back to school year 2021-22, and that is online learning. We do know that with the Delta variant, there have been concerns that parents have been looking into the possibility of online learning, still harboring much fear about transmission in schools, their families, which is understandable. So tell us what you know about what the state has required this year and what you see school districts doing.
Well, first thing, what we called hybrid learning, which was a mixture of online and in-school education, that's kind of off the table. Although not everywhere, there are still districts in the country, quite a few, who are doing hybrid education, and probably more doing hybrid, according to some research I've seen, than who are doing distance only. Now, the other thing that's not really happening is if you want your kid to be in class at your school and just do it online. I want the experience at my school, but I want it to be online with with a teacher from my kid's school. Well, that's not happening either. What's generally happening is you have to kind of enroll in a different program if you want it online. Now, you have a right as a parent in online education for any reason. If you have health concerns, other worries, you can get that, but it's being organized under this guideline of independent study. And independent study was usually historically a lot for kids who weren't making it, right? Or sometimes it was used by actors who didn't have time to be in a regular school, child actors, for example, or for kids who were doing counseling or, crime victims, whatever, incarcerated kids. They would give packets, they would have special programs, but now it's the option. And the online option in LA Unified, the independent study option, I should say, is called City of Angels. And it's been there for years, but now they have 10 times as many students as they had before. And we have to see how well prepared they are for that. And it's supposed to be more robust than before. So it is going to include live online instruction, but it's not going to be with the teachers that you're used to having at your kid's school. It's going to be essentially at another school with other kids, and they're not necessarily going to be on the same page, the same chapter, the same topic as the kids in your school. So even though you can move from one to the other, there's going to be a little bit of a disruption. You might not be learning the same things or be at the same place in the curriculum, and you'll be having to get used to a new class and a new teacher all over again. And in LA Unified and other districts, not just LA Unified, because these problems are pretty much general, we've had parents complain that it's really hard to get into the independent study option. There's a 20-page master agreement, and that districts are really discouraging it, and they wonder whether the quality of that option is going to equal the quality of the in-school option. But they are so concerned about the physical safety, the health of their kids, that they want to do it anyway. But it is a relatively small number of parents who are choosing that, either because ultimately they want the benefits of in-person education, or districts are making it so not worth their while to choose online that it's dissuading people for that reason.
The LAUSD, the latest LAUSD figure is just under 3% of parents, correct?
As of a couple of days ago, right?
Yeah.
There also were reports from parents that they tried to get on webinars explaining the independent study option, and it crashed because there are already 1,000 people on the webinar. And I have to check this out, but also anecdotal reports saying that, your kid might not get into this program because there might not be enough space. That wasn't the story from district officials at the school board meeting on Tuesday. They said that it would be fully staffed, but there are parent concerns out there that, at least in the minds of parents, are not completely resolved.
Thank you, Howard. I just want to go back to both Amina and Howard as we wrap up this chat here. If there's anything that I have forgotten to ask that we think it's essential for parents to know after this hour, Amina, any closing thoughts?
No, I think that, basically we're dealing with a lot of unknowns with Delta. It's a moving target. The most important thing is to take the protocols very seriously, and also not just for students, for families to take them seriously. Because again, as long as kids aren't vaccinated, they're as vulnerable as the community members that they are around. So it's not just about schools; it's also about their exposure outside of school. So that's something to keep in mind.
Thank you, Howard.
Well, parents have to consider trade-offs, right? So a parent has to weigh the risk of social isolation, easy for me to say, versus the risk of catching the coronavirus by going back to school. And there's no such thing as a zero risk environment. Every time we exist on Earth, we are facing risk, and the risk is never zero. And parents have to weigh, what is the greater risk? What works for me? There are some medically fragile children, and there are children who belong to families that have medically fragile people. And for them, it is absolutely the best choice to pursue an online option. The school districts, the school officials, and most health experts, it seems, to date, seem to be saying that for the vast majority of children, as long as the protocols are followed, the best place the child is in the school, because there are also harms from not being in school. There's social isolation, there's academic harm, there's things to make up for. I mean, being a parent is not easy. All of us parents out there can vouch for that. Although it is the one not easy, magnificent thing in life that you can do that is open to almost everybody. So it's also a great privilege as well as a challenge, but it is not easy. And it is certainly not easy now, because not only do you have to keep your kid healthy and fed, but you have to make sure they're safe at school. And you have to make sure that your school actually is following the safety protocols, just as much as you try to track whether the child's teacher is keeping your child up to date academically. There is extra help at schools. There is mental health counseling. I mean, LA Unified did not staff. I mean, they fell way, way short in mental health staffing, but there's more than there was before. And parents should take advantage of that, and they should get the help and the counseling they need. There's also, in a way, we have something we did not have before. We have digital tools that the child can use at home, and we also have in-person at school. Before, we had in-person at school, then we had digital only. Well, now to some degree we have both, and we can use that to help kids. We can use the digital tools to better keep track of how kids are doing. We can use it, parents can use it to communicate with teachers in ways they didn't before. So we can try to make something good out of this difficult moment as well. And good luck, everybody out there.
Thank you, Howard, and thank you, Amina. And thank you all for joining us this afternoon. It's just such a privilege that you spent this time with us. I wanted you to know a couple of things. We're here for you, and we want to talk to you. And Howard and myself, Amina, all our reporters are available, and our email protocol is really easy. I'm Stephanie.Chavez at latimes.com, howard.blume at latimes.com, and amina.kahn at latimes.com. Please reach out to us. We want to talk to you, and it's really important to hear your questions, to hear your concerns, and to find out what's going on at your schools. So please know that our virtual voices, our virtual doors are open to you all the time. The other important thing I want you to know is that I know we covered so many things this afternoon, and everything is memorialized in great detail, and actually far more questions than we could even get to today, on our Back to School guide, which is now on our website, and it's on. So go to latimes.com and you will see how we have answered all these questions, and all your back to school questions are answered in this guide. We will keep adding to it as more questions come in from you and others. We're going to consider this a live document. Take a look at it now. There's everything we talked about plus more on it right now. And moving forward, we are going to, just so that you know ahead, we're going to be looking at what is going on with online learning, and is that going to take off? Is there going to be problems, or is it just not going to become an issue because things will run smoothly? We are working on a story on coronavirus testing and how that is going to unfold at LAUSD. They have biggest testing program in the nation, which is going to be a fascinating look on how that is all being carried out. Howard is with us with LAUSD coverage. Amina is, and the science team is tracking impacts on students, on children, on adults. So I just really encourage you to keep us top of mind, top of your phone, and to reach out to us, because we want to be here for you. And with that, thank you so much for joining us this afternoon, and I hope back to school goes smoothly for you. Thank you.